On this video today, guys, we're going to go over shoulder impingement, what it is, and 5 exercises to help fix it. I'm Dr. Joey Seaforth, physical therapist, athletic trainer, strength and conditioning specialist with Comeback Performance and Wellness. Let's get into it. Let's talk about shoulder impingement. What's happening in shoulder impingement is one of the rotator cuff tendons right here, as it comes across, is getting pinched or compressed. This most often happens when we bring our arm across, and as we lift up, we get that pinching sensation right there, and it doesn't feel good. So let's talk about a couple exercises today to help alleviate it, and also a little bit more about what's going on. 2 things that we need to address with someone who's having shoulder pain is allowing the shoulder to get into better position so it's not pinching on that space, and also working on the rotator cuff strengthening to give this ball and socket more support. When we have weakness of 1, 2, 3, or all 4 of the rotator cuff muscles, this ball and socket joint does not stay centered. It tends to move forward or it'll glide up, and it compresses that space in the shoulder. So let's get into some exercises to help. Doorway stretch. You can either do this with both or just one arm at a time. So I'm going to find a rig or a wall. I'm going to come right here, and I'm going to lean forward. I'm going to feel these fibers all getting stretched, and then I'm going to come back out of it. So I'm going to lean in, couple seconds, back out. If you have long enough arms, you can come into this position, and you can do the same thing. So you're going to lean into it, come back out. And this is the exact stretch that we want. We don't want to cause pain with this exercise. Leaning in, coming back out, just like that. 2 to 3 sets of 15 reps will do the trick. Next exercise is wall open books. We're going to be opening up our thoracic spine here, so we're not cranking on our shoulder to get into those positions. So what you're going to do is you're going to get a half nail position on the wall, just like this. This hip is going to be touching the wall. I'm going to have my hands together, and I'm going to open up, follow my eyes with my hand as far as I can go, and come back just like that. You don't want to be getting shoulder pain. You don't want to be causing cramping anywhere. If you are, you're pushing the movements, and that's not what we want. Just nice and easy. Open up. Good. The more you do these exercises, the easier this motion is going to come. So don't push the movements. They will come with time. It's nice and easy. Good. The whole idea is we're trying to get rotation in our thoracic spine there to help open up the shoulder joint. The next 2 exercises that we're going to be doing are going to be eyes, like this, and T's. But we're going to be doing them face down. The whole idea behind these exercises is we're trying to target that low and mid trap that sit in between and underneath the shoulder blades here. So let's get into this exercise. You're going to lay face down and you're going to relax your neck. So I'm going to come into this position. I'm going to keep my arms, my palms up, and I'm going to lift straight up. So just right here, back down. You should be feeling that engagement right through here as you're doing the exercise. And once again, we're not trying to cause pain with this exercise. Next exercise we're going to do, guys, is we're going to be trying to hit a little bit in between the shoulder blades with a T motion. So just like that. So I'm going to get in that same position as I did for the eyes. I'm going to be face down, relaxing my neck. Arms are going to be out to the side, and I'm lifting straight up, back down. Now we're going to be targeting more of the muscles in between the shoulder blades right there. With the eyes and T's, you want to shoot for 2 to 3 sets of 15 reps each with a 2 to 3 second hold per rep. Next exercise is banded external rotation at our side. So you're going to grab a towel or a pillow. You're going to place it underneath your armpit like this. You'll have a band. You're going to be right here, and you're going to walk out. I'm going to have my belly button touching my hand, and then I'm just going to come into this position here. Nice and slow, nice and easy. You should be feeling the back of your shoulder being engaged as you're doing this exercise. Coming here. Things we want to avoid is having our shoulder come into this position, because this is often closing off that joint space in people that have impingement. So nice, good posture right here. Coming out, coming in. Sets and reps to shoot for this one is going to be 3 sets of 10 on each side. All right, guys, let's bring it all together with what shoulder impingement is and these exercises. So we talked about how shoulder impingement is mostly as we're bringing our arm across, lifting up, or even if we're bringing our shoulder in this position, it can light it up. So we know that rotator cuff muscle, as it's going through this space here, is getting compressed. So these exercises are all designed to help open up that space and also give you the strength in your shoulder. This pec wall stretch is going to help loosen up all the fibers in the front of the shoulder, so it's able to move more freely across. Our thoracic rotation exercise is going to help get more mobility through this upper back here, so you're not putting as much stress on the shoulder. The I's and T's are going to target that low and mid trap to provide more support in the back of the shoulder. And then our banded external rotation at our side is going to hit the back of the shoulder as well with strengthening. In combination, all these exercises are supposed to help move you in the right direction, but you want to make sure that you're limiting the amount of motions that are irritating the shoulder and getting it as strong as possible while improving your mobility. Please like and subscribe to the channel, guys, if you want more shoulder content, and please reach out in the comments for any future videos that you want.